My name's Jay Spiegel. I'm an assistant professor at the University of Miami Sylvester Comprehensive Cancer Center, and I'm presenting an abstract today combining two active drugs, Mosunetuzumab and Polatuzumab, with axi cel, which is a CAR T, in recurrent refractory aggressive large B-cell lymphomas. CAR T has been approved since 2017 in aggressive large B-cell lymphomas, and it puts many patients in a complete response, so we can't find the tumor anymore, about 60%, but long-term remission, so patients that remain alive and free of disease, is only about 30 to 40%. So that suggests that most people, their disease is going to come back even if the CAR T is effective. So we wanted to do this trial to see if we could increase that number of patients that have these long-term responses. So as time has gone on, companies have come out with other active agents targeting the immune system, like Mosunetuzumab, and also other unique chemotherapy-like agents like Polatuzumab. So we thought, why don't we just smash them all together, basically? It's a phase 2 trial, and our goal was to enroll about 30 patients, so we're reporting on the first 25. And the way of the trial is structured is that we give the two drugs, Mos and Pola, before, then patients get the CAR T and get 1 dose of Mosunetuzumab, and then they can be eligible for 3 doses of Mos and Pola after. So it's kind of a total therapy approach, right, before, during, and after. We enrolled 25 patients. It looks pretty typical for that of a CAR T trial in aggressive lymphoma. And our primary goal was to see what the complete response rate was 3 months after CAR T infusion, kind of as a barometer of how well we do. And our goal was to beat 40% complete response rate. So what we'll be reporting is that at day 90, we actually have a 92% complete response rate. So we're very excited about how we did. And the thing that I think is most exciting is that it looks durable, that the patients that get in remission are largely staying in remission. So at 1 year of follow-up, 80% of patients are still in remission, 79% to be exact. So obviously that would be a really encouraging number to see. And so, this is our initial report. Obviously, we keep following these patients and we'll see how we do over time, but that's a really exciting number. Typically, patients that are in remission 1 year after CAR T very rarely relapse. So that in particular is something we're focused on. With regard to the toxicity, so, patients that get CAR T can have cytokine release syndrome and neurotoxicity. We used axi cel, which is a drug associated with more toxicity typically than the other ones that are available, like liso-cel. The toxicity that we saw is similar to that if you just use axi cel by itself. So about 95% CRS, but low grade, so easily treatable. And then as far as neurotoxicity, about 60% of patients got any neurotoxicity. And then the more significant grade 3 toxicity was in 29% of patients. But similar to that if we just use axi cel by itself. So it doesn't look like there's an increased safety signal there. And then some of the longer-term things that we worry about after CAR T, like infections, 40% of patients got a grade 3 infection, so that's needing something like IV antibiotics or going into the hospital. All were able to be treated. And that also was similar. If you follow patients for 1 year after axi cel, we found that that's a typical rate of infection. So there might be a little more in terms of viral infections, but overall it looks pretty similar. And then another thing we worry about is low blood counts after CAR T. Again, maybe a little bit more low white blood cells, a little longer, but by 1 year after CAR T, largely all of your blood counts recovered. So, in all, very high response rate, which we're excited about. It looks durable, and the toxicity, while it's there, I think in general is in keeping with what people who are getting CAR T will experience in general. So our goal is to take this result and then do a second follow-up study where we actually randomize against CAR T by itself, and that hopefully will be able to prove whether this really is more effective than just using CAR by itself. So stay tuned.
If our videos have helped you in any way and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference. and we're deeply grateful for your support.